question becomes this. Although I don't want government health care, what do we do to prevent a situation in which naturally most people are going to have more medical bills when they get older? So most people would be able to afford a private insurance plan, you know, early on because they're young and healthy, and maybe in middle life they're still pretty healthy. But what do we do to help a private plan so that when people get older, the rates aren't so high they can't afford it? You know what I mean? And then they sort of lose out. Because I'd rather have the private plan.
So the question is, what do we do in terms of the current structure to get a private plan in the future, because Medicaid kind of prohibits that?
Well, people are not going to have a private plan now because they have Medicare and all that. I'd rather see, that's my earlier point was, I'd rather see the government get out of the business of providing medical care, period, right? And certainly Obamacare. But if we all went back to what we sort of used to do, like when I was a kid and my dad paid basic medical care out of his pocket, and then we had hospitalization just for catastrophic. If we get back to that model, what do? What are some good practices so that when you get older and you're paying your own health care, right, it isn't so expensive, because then that's when so you can afford it.
So what can we do long-term for long-term care?
We have long-term care insurance, but like, you know.
What you're articulating is really the essence of what probably most physicians want. They want a free market system.
Right, yes.
I want to be able to interact directly with patients, bargain with them, agree upon terms with them, but provide the care that they need. If you have that kind of system from when you're born, from the beginning of your life, and you're putting money into an account designated for medical care, by the time you get to be 65, you're going to have an enormous amount of reserve. You add to that a free market system where insurance companies could bargain for your business instead of you going begging to them, then you could get an insurance policy that would fit your specific needs, whether it was long-term care or catastrophic care, whatever parameters you wanted to make available to you. You could bargain with hundreds of companies and say, if this company doesn't give it to me, well, I'll go to this company or the other company. And that's how you construct a true free market system.
Here's the problem we have, though. We've never had one in our country. 1909, the Flexner Report, which the Rockefeller Center backed up by a guy named Flexner, a unemployed principal, went around to actually just certify certain schools that were his schools. He eliminated a lot of competition, and the AMA became powerful. What we have now is, who wrote this healthcare plan? I mean, these two men, obviously. Big Pharma, hospital associations, insurance companies. It's the first time in American history the federal government is telling you must buy a private product. What you want will never occur, because what they want is on Medicare when older, Medicare when old, Medicare when younger. Now, this is a very interesting part. If you're on Medicare, every 5 years you must have an end-of-life conference. So there's your answer for your dad, is end-of-life conference every 5 years. And they'll walk you through how to end life and get your plans. That's a forced regulation in this healthcare plan. So I'm going to go back to the very beginning. I know I'm not being sarcastic here. I'm not that smart, all these details. Where enumerated functions is healthcare. See, I'm tired of trimming around the edges. I'm tired of it. If I want to cut your cancer out, I'm cutting it out. When we go around here, put a ban on these kind of things, it ain't going to work. I don't want the government to tell this young man he must have a healthcare savings account. Screw it. He must have infertility for his wife he's not married to yet. See, what you're doing, we're forcing us to actually buy a private company, and the private company makes the profit. By definition, when the government merges with a private company to monopolize a field, that's called fascism.